Legacy was founded more than 30 years ago and was uniquely positioned to confront the HIV/AIDS crisis. 10 years ago, we expanded our mission to care for all members of our communities. Recognizing that a large segment of the city's marginalized, indigent, and underserved population went without health care, Legacy stepped forward with a vision and a plan to provide high-quality, low-cost health care in a non-judgmental manner. Now, Legacy's devoted team connects communities to health every day in every way across Southeast Texas. Last year, Legacy served more than 109,000 patients through more than 315,000 visits, with a wide range of services, including primary care for adults and children, regardless of their ability to pay. Patients also have access to behavioral health, dental and vision services, as well as family planning, wellness and nutrition, and comprehensive HIV/AIDS care. Going beyond the exam room, Legacy collaborates with corporate partners who are also dedicated to improving the lives of the people in the communities where they operate. One such partnership is with H-E-B, a successful family-run grocery chain with more than 300 stores throughout Texas.
This year we're celebrating our 110th anniversary, and giving back to the community is something we've done from the very start. In many of the cities where we operate stores, we're the only supermarkets. It doesn't matter if it's a small town or a big city like Houston. H-E-B is committed to being an important community contributor. And so if you look at a program like this Little Readers program, or if you look at Legacy, what they do in the community, it really links in with what H-E-B does, and that's giving back. So one of the things we love about this program is it was inspired by a doctor. You know, you really can't start too early in reading to your children. So often, parents are taught about the importance of feeding and bathing and doing the basics with their kids, but really there's nothing more basic than talking to and reading to your children. So many kids have a 30 million word gap by the time they reach their 4th birthday, and they're entering kindergarten way behind middle-income kids and high-income kids. And so that's why we think that this program by Legacy is so important to help kids get caught up.
Childhood literacy opens the door of opportunity for many children in lower-income households. Reading proficiency by the end of the 3rd grade is a crucial benchmark in a child's educational development, and studies indicate a child's early school performance improves when their parents are involved in helping them learn to read. But families living in poverty often lack money to buy books and have difficulty accessing libraries. On average, there is only one book for every 300 children in low-income areas. Legacy, with the help of H-E-B, is driving healthy change in our community through the Little Readers program. Rooted in the special relationship between pediatrician and parent, Little Readers offers a prescription for reading to promote overall health and success. Legacy providers will give children between 6 months and 5 years old a free book at each of their Well Child visits. At home, parents are encouraged to spend one-on-one time reading with their children. This simple act helps develop a bond between parent and child and also positively impacts the child's brain development.
My name is Luca. I started kindergarten this year. When I was little, my mommy and daddy had trouble reading, so they never read to me. One time, my doctor told my mommy she should read to me every day. She gave us a prescription for reading and a book of my very own. That night, my mom and dad took turns talking to me about the book. Later, they read the whole book to me. Now they are good readers, and I am too. Being in kindergarten, I'm glad I can read, and I like spending time with my mom and dad. Thank you, Legacy, for helping me be a little reader.